Hi, everybody. So, thank you for joining our Canine Cancer Alliance webinar. Today, we're going to talk about new canine cancer detection tests that's become available in the past few years. This is a picture of my grand dog, Leo. And I got a text message from my daughter about 6 months ago. And she sent me a picture and she said, could this be cancer? So, of course, I looked online and looked for pictures of things that are similar. And I came across this one, cutaneous hemangiosarcoma. So I said, you should take him to a clinic and have it checked out. And eventually she did. And after leaving him at the clinic for half a day, he was sedated. He had biopsy done. Biopsy result came back benign. So that was really, really happy ending. And if you do have a mass that could be checked out with biopsy or fine needle aspirate, then there are actions that you could take. But if the dog is just acting off or your dog is becoming older, and we know that cancer, unfortunately, incidence risk starts to rise, go up higher and higher, especially for certain breed types. So is there a better way to do cancer detection, early cancer screening? And so that's why these different tests are now available. And I'm going to be talking mostly about three of these, but I also included one called Oncocanine from PetDx, which is no longer available. They carried out lots and lots of tests and published a number of papers. So I thought we'd start with their paper and just see what they learned from their tests. And then we'll go and talk a little bit about NuQ test, which is available. It's a blood test that you have done at the clinic. So you have to go to veterinarian to have the blood drawn. And then the newer test, one's called ScoutMD, and another one's called Oncotect. ScoutMD relies on scent-trained dogs to tell you if the saliva sample that you send might mean that your dog might have cancer. And Oncotect uses nematodes, so worms, and they use saliva and urine. And these two tests at the bottom, ScoutMD and Oncotect, you can actually order from home, and they are relatively inexpensive. So this is an ad that I saw on Instagram from Oncotect, and it says 90% accuracy. So, what does it really mean when it says 90% accuracy? I want to say that these tests are not going to tell you what type of cancer your dog might have, but it just detects general cancer signal. So it's very different from something like Cadet BRAF test, which is looking for specific gene mutation that's present in most of dogs with bladder cancer, transitional cell carcinoma, or urothelial carcinoma. And this Cadet test has been around for quite a long time, and vets rely on it to help determine if the dog that's peeing frequently has just a urinary tract infection or might have bladder cancer. So these new tests are general cancer tests, not specific cancer tests. But as we go through, look at the data, you'll see that they are much better at detecting certain cancer types than other cancer types. This was a test that was sponsored by PetDx, where they looked at over 1,000 dogs and looked to see when they started getting cancer based on breed. I don't know if you've seen this result from a study that was sponsored by PetDx, but cancer incidence rate goes up quite rapidly depending on the breed. And PetDx had recommended that screening start as early as 4 years for larger breed dogs, because by age 4, they were seeing about 25% of the dogs being studied were being diagnosed with cancer. And for dogs like Golden Retriever, it was 6 years, etc. But of course, as they age, the risk of cancer diagnosis does go up. So is it possible to rely on these new tests? Now, this PetDx test, which is not available anymore, relied on measuring cell-free DNA in blood. So you had to go to the clinic, they would draw blood, send it in, and then you get the results back. And the results would say that it does not say which cancer your dog has, but it would say that there's elevated risk of cancer or not. They ran a large test with their test, and PetDx reported that the most aggressive cancers like lymphoma, hemangio, osteosarcoma, detection rate was about 85%. And then if you included other types of cancer like mast cell tumors and melanoma, then the overall sensitivity dropped to about 62%. So we created a table out of their data and excluded the cancer type for which they had fewer than 5 dogs involved. And so any data that they had 5 or more dogs, we plotted on this table. So for example, top was lymphoma, intermediate to large cell lymphoma. This they did indolent lymphoma separately, but they claim that they have sensitivity of about 93.8% for lymphoma. For hemangiosarcoma, it was 83%, but then the number of dogs was only 12. Osteosarcoma, they had 39 dogs, and 28 dogs were correctly diagnosed, or 28 of those dogs had elevated so-called cancer signal, which is 71%. And also histiocytic sarcoma is also had a good sensitivity. Now, but the rest of cancers like lung, skin, liver, melanoma, the sensitivity percentage drops quite a bit. Now, I'm just showing this to you, even though this test is no longer available, because they did do much more extensive tests with more dogs than the other teams. And it's interesting to see the difference in sensitivity for different cancer types. Now, PET-DX test was about $1,000 and it was quite expensive. And their investors pulled out a couple months ago. And so they are no longer offering the test. They're no longer in business. But there is a test called NuQ test from Volition, and it's also a blood test. And it measures nucleosomes. And nucleosomes are these bead-like structures that DNA actually coils around. And so if you unwrap chromosome, you'll see these strands of nucleosome. And that's what they count. Again, it doesn't tell you, this test doesn't tell you what type of cancer your dog has, but it will give you some kind of cancer signal conclusion. So their paper looked at about over 500 dogs with cancer, and their conclusion was that they had pretty good sensitivity for lymphoma and hemangiosarcoma. And here's a table. So hemangiosarcoma, they had 77 dogs. Sensitivity was 82%, almost 82%. Lymphoma was 76%. So it's a little bit similar to PET-DX's results. So those two, hemangiosarcoma, lymphoma, very common types of cancer, and it's sort of systemic cancer. They had very good sensitivity. But the rest of type cancer, like histiocytic sarcoma, melanoma, osteosarcoma, osteo is only 34%. So I was talking to an oncologist, and he said he actually relies on this NuQ test when he has a patient with a mass on the heart, because it could be cardiac hemangiosarcoma, or it could be another type of tumor. And so to make that distinction, he actually orders the NuQ test to find out if it might be more likely to be hemangiosarcoma or not. Now, the interesting thing about the NuQ test, because NuQ test has been around for several years, they have done more studies. And they looked at a number of blood cancer patients and realized that their test could be used as a prognostic test. So that if you have elevated nucleosome levels, which is blue, then you had poor prognosis compared to dogs with lower concentration of nucleosomes, which is the red diagram. And I also had a chance to talk to the inventor and the founder of Volition, the professor behind this technology, and she said that she is now looking at using it to track the progression of disease, especially for hemangiosarcoma. And they're collecting samples and data. And she said that for some of the patients, you could see that before splenectomy, you see very elevated concentration. And then after splenectomy, the level goes down. And then it stays down as chemo treatment is started. But as the patient comes out of remission, the NuQ test number starts to go up again. And it may be a way to see if a dog is coming out of remission even before clinical signs or imaging, other things can measure. So it may become a tool not just for early screening, but for disease monitoring. And this is important because for something like hemangiosarcoma, treatment options are very limited right now. But in a few years, we believe that there will be multiple options, especially with immunotherapy. So we are supporting a study here in Seattle that's looking at combination of surgery, carboplatin, EGFR HER2 peptide vaccine to see if that combination could help splenic hemangiosarcoma patients live longer. There are other hemangiosarcoma immunotherapy studies that are starting. So in a few years, there are going to be multiple immunotherapy options. And so if one therapy is not working, you might have other options to try, and you might rely on something like NuQ test to guide you or guide the vet. I'm going to now talk about ScoutMD test. And this is a test that relies on scent detection dogs. And it's been known for a long time that with human cancer patients, that dogs can detect tumors. And so the team trained a number of dogs with canine tumor samples. And they use actually saliva sample that contains the VOCs released by cancer cells. And it's at-home collection. So you get a little kit with a Q-tip, and it's very simple. You swirl it around the dog's mouth and then mail it in, and then you get the results in mail. And the results will say how many of the dogs were in agreement. I have a little experience with this because I tried it with my dog Momo, and I'm going to share what happened a little bit later. So it's very simple. It's under $100, but it's relatively new. And even though they have a publication, and the publication says that they had dogs with cancer involved in their training and testing, and they looked at different cancer types. The data behind it is not, there just isn't as much data behind this test compared to the NuQ test. So with their limited test, they say that the mean sensitivity is 90% and specificity was 98%. So we actually ordered some tests and sent in some samples. And what we found was it varied. There was definitely false negatives and false positives. And it was not very large number of dogs, but there were 2 dogs with hemangiosarcoma. Saliva samples were sent in, and both came back negative. And then 4 samples were sent in from dogs with confirmed osteosarcoma, not under treatment, and they came back positive. So 4 out of 4 dogs with osteosarcoma came back positive, which was great. Hemangio they missed, and maybe perhaps these dogs were not trained with hemangiosarcoma patients. We don't know. But what we expect is that this company will continue to collect more data and publish the data so that we'll have better understanding of which types of cancer these dogs are being trained on and are getting better at identifying. Now, the next test, Oncotect test. It's a urine-based test that uses nematode C. elegans, really high sensitivity in their olfactory system, which they use to find food and navigate their environment. And they say that they've got more olfactory receptors than dogs. And it turns out, based on their study and also a study in Japan, that they are very strongly attracted to urine from dogs with cancer compared to healthy dogs. So they move toward samples of urine from dogs with cancer. Again, this test is really simple. You only need about 1 milliliter of urine, and you can do that at home. And you can send it in, and they send you back the test results very quickly. So their paper says that they looked carefully at melanoma, lymphoma, mast cell tumor, and hemangiosarcoma, and their sensitivity was 85% and specificity of 96%. Now, the sensitivity here, they had 2 dogs with soft tissue sarcoma, and that was 100%, they said. Mast cell tumor, 12 out of 13 dogs were identified correctly. Lymphoma, 10 out of 11. Mangio was 9 out of 11. Melanoma was 8 out of 11. So overall, they said that the sensitivity was 85%, but the total number of dogs they tested is only 48 dogs. So, and also they look at dog samples from dogs without cancer, and they said that for that, they were correct 90% of the time. So, this looks great, and that's why they said that their test results are 90% correct based on these conclusions. But we are really hoping that they're going to publish more data, and they're advertising everywhere. So I'm sure a lot of people are going to be sending in samples, and hopefully they'll learn much more about the sensitivity and accuracy of their test and publish those results. It's on sale for $199. Let's see. So Momo, this is my dog Momo, and in March, her ScoutMD test came back positive. It said 5 of 5 dogs, they all agreed that there's something suspicious about her saliva sample. So I became frantic and I ordered NuQ test, and I also sent an Oncotest. and they came back negative. And I talked to the local vet, and they're confused about what to do. They said maybe I should take her in for ultrasound exam. Now, it turns out 12 months earlier, she did have an oral mass, kind of what our oncologist called very wimpy mass, wimpy tumor, and it was treated with electrochemotherapy. And so we took her back to oncologist, and they did a comprehensive exam, and they concluded that there was nothing remarkable, nothing suspicious. So I am not completely sure, because her tumor before was growing on her gum, and ScoutMD's test is based on saliva sample. Perhaps those dogs were sensitive and were catching some that the other test did not catch. But it is not really clear cut what happens after you do this test. When it comes back, especially when it comes back positive, it could be false positive, it could be false negative, and you are probably going to have to do more tests to rule out and to see if there is really a cancer or tumor there. So these tests are good, but it could be complicated. I'm also going to mention that there's a new test, Raman spectroscopy based test that came out of, that's being worked on at Virginia Tech. And this is a research team that's been using urine drug test kits, and they basically take urine sample and then shine laser at it and look at the spectrum, the light that comes through, to see what kind of molecules are in the urine. And they are starting to publish their results. It looks quite promising, but they don't have commercially available tests yet. So this is still research test, but we're talking to them and keeping track of what they're working on, and perhaps testing this also with hemangiosarcoma patients to see if it can be reliable in monitoring disease progression. So Virginia Tech team they've only tested with about 100 dogs, but I think that number is increasing very rapidly. Another test that I want to mention is a test called Vista. And this comes from a company in Israel, and it's a very interesting technology. It's a scanner. And so if you have a lump, if you have a cutaneous or subcutaneous mass, then you can scan this mass in real time and get real-time results that says that there's a risk of it being malignant, or it's most likely benign. And it is slowly becoming available in the US. In Washington State, there are only 2 or 3 locations that offers this test. And we're trying to talk to the doctors who are using it to see what their experience is like. And so far, they have published their results, and they've looked at hundreds of over 500 masses. In that published test, they said that sensitivity was 85%, which is 45 out of 53 malignant masses were correctly identified as high risk. And then the benign masses were 253 out of 378 benign masses were correctly identified. So Vista is something to keep to monitor to see if it becomes available, because then it might be possible not to jump to doing biopsy and do this test. Whenever I see my son's dog, she has a little lump behind her neck, and it seems to be growing, and I keep on reminding them to take her to the vet. And I think I'm just going to have to take her to the vet next week. But if this test was available, then it might be easier than having go through surgery or get biopsy done. So to summarize, we talked about NuQ test, ScoutMD test, Oncotect. So they have different sensitivity based on different types of cancer. NuQ test requires blood sample drawn at the clinic, and they seem to be very good at detecting lymphoma and hemangiosarcoma. And the test is a few $100s, and they have been around for a while. So they're publishing a lot of data. ScoutMD and Oncotect are relatively new. They can be ordered at home. They rely on saliva samples and urine. ScoutMD hasn't really published the type of cancer, the sensitivity based on the type of cancer. Our limited experience, just with 4 samples sent in by osteosarcoma patients, performed well. Hemangiosarcoma did not. It is very affordable, and we're hoping that they're going to be publishing more results as they collect data. Oncotect, they claim that mast cell tumor, hemangio, lymphoma, and melanoma they can detect with higher reliability. They're also quite affordable. I think it's like $199 on sale. And then there are new tests that are coming out. Raman spectroscopy test, Vista test is going to be available. And just wanted to conclude that basically all these tests do have varied sensitivity across cancer types, even though it says it can detect cancer. For some type of cancer, it's only 30%. For other types, it could be 80 or close to 90%. The newer tests do lack data. In-home sample collection, anything that involves sample collection at home, you do have to follow the instructions really, really carefully. Both ScoutMD ScoutMD and Oncotect CEOs said that the problem, they often have false negative, false positive results, and sometimes it's because the person collecting the sample is not following the directions very, very carefully. But overall, you just have to weigh the false positive, false negative rates and all the implications. It doesn't solve our problem completely, but it's a step in the right direction.